Hi guys, my name is Tristan. I want to discuss today my comprehensive mental health profile, and the reason I am mostly doing this is not only for informative and entertainment purposes, but also to help educate professionals for research purposes and to share my experience with everyday people. This is my contribution into the convoluted pool of possible conditions and medication outcomes. I apologize if I don't always look into the camera. I need to read my own writing in order to deliver my video effectively. In 1988, at age 4, I had an early diagnosis of ADHD. This is significant because in 1988, awareness of ADHD was known but not ubiquitous in people. It was still largely ignored for adults, and even most children wouldn't come across a diagnosis in 1988. There was no doubt that I was different because I was extremely hyperactive, and in some cases I would become disruptive and destructive mindlessly, but was not violent like some ADHD patients are. In 1988, ADHD meds usually consisted of short-acting Ritalin, and by my mid-childhood, the doses that I was on were rather high, so this combined with the ADHD itself to result in a rather potent behavioral and endocrine modification in me. At age 15, I refused to keep taking the Ritalin, citing its suppressive effect in allowing me to socialize, or inhibiting my socialization. This opened the door to developing peer relationships, but I often ran with a rough crowd and didn't care about the status or stature of my friends or what behaviors they engaged in. I was just happy to be part of the equation. My academic performance plummeted. In 2000, at 16, my parents made me see a doctor again, and this time I was diagnosed with Asperger's syndrome, but they only put me on Paxil, which had a negative effect on my sexual health and was sort of tranquilizing for my behavior, but my academics were still so bad that I would be objectively unable to do studies that even at this age I can master flawlessly. From age 18 to 20, I was not consistently getting psych care. I was smoking weed daily, and by this time I had been maintaining a relatively stable position in society, a little rough around the edges, but I got by. The weed was a surrogate medication for ADHD-related depression, a surrogate for dopamine modulation, because before I began smoking weed daily, I was way less stable. However, the weed was a rather dirty substitute for psych meds because of naturally erratic dosing. By this point, I stopped regularly getting fired from low-level jobs and would just barely perform enough to keep a job that I had for up to 1 year at a time. By determination and grit, I was eking out a normal social and work life, considering that I was a late adolescent. I was attending college and would perform okay academically, but would struggle to stay with the program until getting any degree. I would never get a degree despite multiple attempts at college because I would always abandon my program after 6 to 12 months on a whim. After success in waiting tables amid a relatively hypomanic but stable and productive age 20 to 22, at age 23 to 28, I entered the most dangerous time in my life. At age 22, I wanted more from life, so I decided it would be ideal to move to Los Angeles by myself and attempt to get into the entertainment industry. I was already doing sex work by then. I transferred my position at Olive Garden from Waterford, Connecticut to Burbank, California, and secured my own one-bedroom apartment in North Hollywood because in 2007, this sort of thing was still economically possible for a relatively tenuous late adolescent. Upon arriving in California, where I met a few friends I knew from high school, it was suggested that I accept an adult modeling contract on account of my physical appearance. I was super willing to do this. I was still not seeing any psychiatrist, and I promptly found myself with a relatively solid amount of money and freedom. I became a binge cocaine user within a month of arriving in California, just as my adult career was blossoming and a circle of folks were orbiting me. I descended into severe mental disorientation and erratic behavior, and this occurred as if it was just Tuesday. But I always had the ability to not only pay my rent, but to hop around the country on various assignments. I began releasing poorly produced music videos featuring David Lynch-style content and drew significantly negative attention from some folks in the LGBTQIA community, as well as Christian communities, on account of my erratic and overly liberated behavior. It was here that I began exhibiting symptoms of mild schizophrenic or bipolar type illness. By my 30s, I began to stabilize because I decided to start pursuing sobriety. Through the Van Ness Recovery House in Hollywood, I was introduced to a sensible, logical, responsible, and practical behavior. I became dependable, cynical, and intellectual. I began maintaining psychiatric treatment and was reintroduced to ADHD stimulants in a way where I could take them responsibly, and discovered that these, alongside antipsychotics, were stabilizing and opened up my mind to very profound benefits. My logical and dependable environment continued to encourage responsible use of my medication. I was on Social Security disability. However, I began pursuing a return to a career path. In my 30s, I maintained psychiatric treatment, but for most of this decade, I had pulled myself off of ADHD stimulants due to fears in the recovery community that I would abuse them and return to a situation that was like my 20s. I would have been better served to stay on the stimulants and in a long-acting or delayed formulation, because it turns out that medications like Concerta modify my dopamine pathways in a way that boosts my natural libido, reduces impulsivity, and actually reduces my incentive to abuse illicit drugs or even abuse the medication. However, shorter acting, older ADHD meds are not as safe for me. Most of my 30s consisted of becoming mildly nomadic, but holding a very regular and predictable series of cycles in which I would be sober and functional and hold down a job for 18 to 24 months before burning out and then spinning out on illicit drugs. Mind you, I was not taking the ADHD stimulants during these cycles. Essentially, it was always extremely exhausting to maintain the structure and employment full-time, and I was financially bound to working full-time. I would maintain rent and have some social life, but no romantic success in the LGBTQIA community, because by this time, the cute, sexy adult star vibe was aging out and leaving me only a history of unstable public perception regardless of which city I was living in. And when I would have the relapse at the end of those 18 to 24 month cycles, I would sometimes have to move back in with my parents. Without ADHD meds, I would have almost no libido, in part because I was always on mood stabilizers and antipsychotics. But in reality, I had libido dysfunction. This libido dysfunction was tolerable for months to a couple years at a time, but eventually pressure within me would build to, instinctively be a man, and the only way I knew how to accomplish this at that time was to abuse methamphetamines, and I would experience a 3 to 6 month wave of severely disorienting and destructive drug use that would bookend a 2-year period of employment and sobriety. This employment followed by substance issue cycle would repeat every 2 years until age 37, when living back with my parents and getting psych care, the doctor decided that I needed, in addition to antipsychotics, an ADHD stimulant of a long-acting variety. The ADHD meds, in conjunction with Risperdal or paliperidone and Seroquel, dramatically improved my mental stability, and since age 37, this combination has been crucial in helping me maintain a lifestyle free of abject substance abuse, because my endocrine and neural health has been at its best this way. The medications allowed me to maintain employment at a blood bank in the Southeast for 2.5 years. However, despite the ADHD medication, the aforementioned cycle of burnout and distress from maintaining a structured and laborsome lifestyle began to reveal itself in 2024. I started to exhibit more erratic behavior again and had one isolated instance of substance abuse, but that was subdued quickly compared to previous years and previous cycles, and I was back on the horse within 1 week and have been since then, which has been 1 year at this point. I had been diagnosed with central and obstructive sleep apnea in 2021, and I began gradually gaining weight and did not tolerate the CPAP treatment. I had gained so much weight by 2024 that I had gone from 170 pounds at age 32 to 230 pounds by age 40. This weight gain was coinciding with a slowdown in my physical activity. In 2023, I would get a lot of physical activity and would regularly vlog my hiking experiences on YouTube. But by 2024, my weight was skyrocketing and I became lethargic. In 2025, I have still taken ADHD meds, but in order to get the maximum benefit and safety ratio, it is important that I take Jornay PM, which is a delayed release medicine and does not provoke reward pathways associated with schizoaffective and substance history. This medication is worthy of research in supporting severely depressed former meth users with ADHD and depression, and I think it is very promising. It is a stimulant, but it is released so slowly that it's not likely to provoke those reward pathways when taken in proper format, but it does support endocrine health and dopamine modulation. Any long-acting ADHD medication reduces my incentive to abuse drugs, but this benefit is not 100% cure, and while I am way less likely to abuse substances or alcohol, it's not a guarantee of permanent full sobriety, and support structures and supervision is still very important for a person such as myself who has this complex history. By 2025, I began experiencing a slow cascade of suspicious neurological symptoms. I have managed to mostly keep substance abuse at bay in 2024 and 2025 and remain stable, but I have become unsteady on my feet at night, swaying when walking, and clipping corners, running into walls while rounding them. I have experienced pronounced central sleep apnea events and sharp, singular but intense electric shock sensations occurring in random parts of my body while falling asleep. When at rest in the afternoon and evening, my lungs feel heavy. I have experienced profound, heavy sensation in my lungs, like the muscles to breathe are weaker compared to the effortless breathing of my youth. I have experienced allergies and asthma, requiring albuterol or primatene mist inhalers, and occasionally allergy medicine due to the animals that I live with. By 2024, I began experiencing a decline in cognitive health alongside a paradoxical sharpening of philosophical thinking, posting screeds online about life and philosophy in general. By starting in 2024, I began compulsively misspelling words and names on purpose, followed by automatically misspelling words, particularly in the latter half of the day. I have begun sometimes having trouble working with my thumbs when texting on a smartphone, and sometimes have to slow down dramatically when typing, but this suspicious symptom does not extend when I am typing on a computer with all of my working thumbs and hands. Since 2024, I have become profoundly lethargic relative to past years. I will get poor quality sleep with night eating, sleep apnea, and restlessness. I usually wake up at 4:30 in the morning, and it is that time that I take my ADHD medication, consisting of long-acting methylphenidate, modafinil, and coffee. But many times this combination, once it kicks in, will cause me to go back to sleep from 5 a.m. to 9 a.m., and bizarrely, my sleep quality on the methylphenidate, modafinil, and caffeine can be far more restful and blissful than when I am supposed to be getting sleep earlier in the night when these meds have worn off from the day before. I had a brain MRI without contrast in 2021 about my sleep apnea. The radiologist only diagnosed mild Chiari malformation. But when I uploaded the images to ChatGPT-4 this year, it flagged multiple slices for hyperintensities, hypointensities, a meningioma or lesion in my frontal lobe, and a schwannoma or lesion in my cerebellopontine right angle. I can see the schwannoma easily, and there is a bright hyperintensity in my central canal in my brainstem, and there are signs of atrophy in my frontal left lobe. From age 3 to 25, I exhibited a need to violently bang my head against the sofa or car seat hundreds of times per day, every day, for years and years to listen to music, especially prior to age 18. And now I'm at a risk for chronic traumatic encephalopathy, aka CTE. I have developed a more sluggish disposition by 2025 at age 41, and a generally weakening of my arms and legs in 2025, resulting in my being sedentary and laying in bed most of the time. I managed to perform some house chores and support my sister and mom, and I managed to get a few long walks in per week, but it is difficult to be motivated to do these physical activities, and too much of them causes me distress. I have a diagnosis of schizoaffective and have had hypomania and depression in the past, but I am suspicious that it, along with my risky behavior in the past, that I actually have CTE. Part of the reason that I believe this is because, unlike many schizophrenics, the ADHD stimulants do not send me into psychosis. They soothe me and calm me down, sometimes even to the point of allowing me to go to sleep. Because of my recent distress that working a job was causing me, as well as having progressive difficulty with maintaining consistent cognitive stamina at work by late 2024, I became unable to work consistently anymore and have just wound up on long-term disability. I am still intellectual, however, and in 2025 I began quickly developing serious skills as a bedroom producer and musical artist, and now I have 30 radio-ready pop bangers on my YouTube and other social media channels. And I would compulsively produce the music flawlessly, often asking ChatGPT how to use the sophisticated production tools in my DAW. I would spend 20 hours a week making these bangers alongside producing music video on Adobe Premiere Pro. This is despite the fact that at my regular job it became harder and harder to maintain focus, even with the ADHD meds. And I would wind up staring at the screen and becoming severely distressed despite doing a good job. I can type and write prolifically in great intellectual detail, but when I have to perform errands, tasks, financial responsibilities, it becomes extremely difficult and distressing to do them, even though I can crank out radio-ready bangers in a frantic attempt to become a pop star who doesn't have all of his teeth. Prior to departing my job at the blood bank in early 2025, I'm sorry, give me just a second, okay? Okay. Prior to departing my job at the blood bank in early 2025, I had begun having a mildly difficult time speaking, biting my tongue occasionally while talking, and struggling to find words even though my brain knows what I want to say. I can engage in casual conversation with no trouble, but if I need to speak in intellectual or elaborate details such as I am writing now, I straight up cannot do it, and I would never be able to speak the way that I am speaking now unless I'm reading from my own script. I have another brain MRI scheduled this summer, but this time it will be with contrast, and I would have had that done already by now, but I have had complications with insurance and being able to afford the MRI because disability is little money and the psych meds are not exactly cheap. The good news is I am generally happy and staying out of trouble, and because of the disability, I don't have to worry about my health problems causing me to become homeless in the future. I continue to be an advocate for research in the use of ADHD stimulants as part of a supportive and healthy recovery from ADHD-related methamphetamine abuse, because my experience has demonstrated for years that, ironically, these medications can relieve depression, allow for a more centered personality, and reduce the incentive to abuse methamphetamines for folks who choose to use the medications as directed. But I cannot give you medical advice. Your personal treatment plan and mental health picture will have to be worked out between you and your psychiatric provider should you choose to get psychiatric treatment or neurological treatment, depending on what it is you have going on. Thank you for your time. Tristan.